Hello, my name is Martha. In this video, I'm going to give materials for HR booth that will help in job fair for recruiting new employees. I'm going to talk about some of the career paths available in the healthcare industry and by showing different options in this industry. So healthcare is all about caring for people's health to help them get cured or get prevented from different diseases. But when many people hear about healthcare, they only hear about things of dealing with patients directly, which is actually not the case, because there are some other different options that are not related with dealing with patients directly. So some of the clinical jobs that are available in healthcare industry are different jobs in hospitals and clinics as nurses, doctors, or specialized in the indirect healthcare personnel, all those. But different healthcare, non-clinical healthcare options that are available in the healthcare industry, I'm going to talk about them in the following presentation. So these are some different non-clinical healthcare options that one can do if he is not interested in dealing with patients directly. One of them is healthcare administrators. This oversees the organization and flow of healthcare projects. So the education that is needed, required for these people to operate, they should be having master's degree in healthcare administration. The skills that they need: financial management, staff coordination, project planning, policy. Like they need to know the law that governs hospitals and ethics, so that they may operate in accordance to the government legal, they may operate legally, and how to guide implementation of different actions at the hospitals. So the second is health information managers and technicians. These manage health records and other information. They should be having bachelor's degree in health information management. The skills that they need include knowledge of terminology, of medical terminologies and medical law, so they can be able to keep information in a legal way, and also medical coding system as they deal with information. So the third, which is the last among the two that I chose, is medical transcriptions. These transcribe recorded patients' histories and clinical information. They should be having associate's degree in medical transcription. The knowledge that they need is the knowledge of medical terminology also, and language and writing skills. So they might be able to write transcriptions, and note taking, of course, and organization skills, so they may be able to organize that the information and the transcriptions, and keep the files. So these are the research collected from the resources of Elon. Let's go ahead and talk about allied health professionals. This is a segment of healthcare field that delivers services involving the identification, evaluation, and prevention of diseases and disorders, like dietary and nutrition services, and rehabilitation and healthcare system management. Some allied health care providers work collaboratively with other providers, including physicians, nurses, dentists. So they may play roles in evaluating and assessing patients' needs, keeping the physician and others informed of patient's progress, and caring for the patient. Others work independently as specialists in exercise, nutrition, health education, speech, and daily functions. So let's talk about the examples of these allied health professionals and some of the explanation. So the first is dental hygiene. These are professionals who care most about cleaning the teeth, like they care about teeth cleanliness, and so they examine patients for signs of oral diseases such as gingivitis, and provide other preventive dental care. They also educate patients on how to improve and maintain good oral health. So the second is the artists. This is the branch of knowledge concerned with the diet and its effects on health. The dietarians advise patients on how to regulate their diet depending on their medical conditions. So the third is radiography. This is an imaging technique using X-rays, gamma rays, or similar radiation to view the internal form of an object. This means that they use this to view the inside of a person to know what is going on, and so that they may collaborate with other providers to help that person get well. So another one is respiratory therapy. This is about educating, assisting in diagnosis and treating people who are suffering from heart and lung problems. They collaborate with healthcare providers for patient pulmonary medical care. So they deal with lung problems, and if they find that there are lung problems, they may work with our providers to provide the medicine for that case. So another one is physical therapy. This is helping patients regain movement or strength after an injury or illness. Physical therapy treats musculoskeletal injuries involving the muscles, bones, ligaments, and tendons. So this is in the case when there is an injury. These people help people, the patients get well. So health, the sixth is health information management. This is the practice of acquiring, analyzing, and protecting digital and traditional medical information. So they work to protect those medical information as a way of protecting patient security and privacy, also coding or record administration, as well as government policies and insurance companies follow-up. So this is research conducted from Explore Health Careers. So let me go ahead and talk about LPN, RN, and nurse practitioners as some of the nurses and their differences in education requirements and job responsibilities. So for licensed practical nurses, which is LPN, they provide basic and routine care. They ensure the well-being of patients throughout the whole of the health care journey. So they need high school diploma or GED, and then they will need to graduate from an accredited LPN program. This is mostly a one-year program. So the job responsibilities of LPN to check vital signs and look for signs that health is deteriorating for improving. They perform basic nursing functions such as changing bandage and wound dressings, and also ensure patients are comfortable, well fed, and hydrated. So RN, which are registered nurses, they provide critical care to the public wherever it is needed. They need the Bachelor of Science in nursing. Some of the responsibilities they have is to perform physical exams and health histories before making critical decisions about someone's health. Another is provide health promotion, counseling, and education. Also administer medications and other personalized interventions. Another one is to coordinate care and collaborate with wide array of healthcare professionals. So the last one is nurse practitioners. These require master's degree in nursing. Some of the responsibilities are to prescribe medication, diagnose and treat minor illnesses and injuries. This is a research conducted from American Nurses Association. So these are the information that we hope in job fair to recruit new employees. Thank you for your attention.